Hi, my name is Kayla Buckles, and I'm going to be performing a neurological assessment. I'm going to be doing this on myself since I don't really have nobody here, but we're going to do the best we can. So first, I would just introduce myself, knock knock, hand hygiene. Hi, my name is Kayla Buckles, and I'm going to be your student nurse today, and I'm going to be performing a neurological assessment on you. Would that be okay? Yes? Okay. Can you please verify your name and date of birth? Yes. Kayla Buckles, 1 to 96. Okay, perfect. So now I'm just going to assess your level of consciousness, orientation, and your mood, and just answer the questions as best as possible. Do you know where you are today? Yes, I do. I'm at Kayla Buckles' house. Okay, perfect. And do you know who the president is? Donald Trump. Okay. And do you know what day of the week it is? Yes, Sunday. Okay, so the patient is alert and oriented times 3. So now I'm just going to assess your level of pain on a 0 to 10 pain scale, 0 being no pain at all and 10 being the worst pain imaginable. What would you rate your pain today? It would be 0. Okay, so the patient states that she is in no pain, so then again, no pain is noted. Now, do you use any mobility aids such as wheelchairs, walkers, canes, or crutches? No. Okay, do you use any medical devices such as IVs, dressings, ostomies that have to care for specialized mattress or SCDs? No? Okay, perfect. So patient uses no mobility aids or medical devices is noted. So now I'm just going to check her vitals. Normal vital signs are 90/60 to 120/80, which is a normal blood pressure. Normal heart rate is 60 to 100. Normal respirations are 12 to 20, and normal oxygenation is 95 to 100. Normal temperature is 96.8 to 100.4. So now I'm just going to test your immediate, remote, and your recent memory. I'm going to ask you to remember 3 words, and I will ask you to repeat them in just a few moments. So just repeat these words back to me. Bed, blue sock. Bed, blue sock. Okay, so I'm going to ask you, and you're going to have to memorize that. Okay? Yes, ma'am. All right, so now I'm going to test your balance and your gait. We're going to be performing just to see if you have a steady gait, smooth, steady, coordinated. So I'm going to go ahead and test that as of right now. I'm going to get you to walk 6 steps forward. 1, 2, 3, 4, 5, 6 in a straight line. Now on the way back, I'm going to want you to walk tandem, which is heel to toe. Forget my cat. And now if you can go back on your tippy toes. And come back to me and just go, just walk back on your heels. All right, so gait is smooth, steady, and coordinated. So now we're going to perform the Romberg test, and that is a test to test your balance. I'm going to stand right in front of you, just like this, with your feet. Please put them together. And I just want you, I'm just going to stand in front of you just in case you sway. We're going to do this for about 20 seconds, and then I want you to go ahead and close your eyes and just stand straight. Okay. And if you have any excessive sway, I'm going to tap you on your shoulders to tell you to stop. 20 seconds has gone by. So the patient has a balance that is intact. They passed the Romberg test. So now I'm just going to assess the upper extremity coordination. So we're going to do pronation and subnation. So subnation, palms up, pronation, down. So we're just going to ask you to just do this back and forth and do it faster. Increase your rate. Okay, perfect. So we already got that done. Now we're going to do the finger to thumb opposition. So you're just going to touch each of your fingers to your thumb. Do it faster. Okay. Perfect. And now we're going to do a finger to nose test. So you're going to touch my finger and then touch your nose. Okay, perfect. So upper extremity coordination is intact. So now we're going to assess the lower extremity, and how we're going to do that is we're going to move the heel of just one foot. We're going to go down the shin. Here, maybe better if y'all see this way. Okay. Ooh. And then we're just going to, let's see, slide one of the heels up. And just do it again. Up, down, okay? And it looks like, let's see, it looks like the lower extremity is intact. And now we're going to test all the cranial nerves. So, let me bend down for this. All right. Be easier for you to see. Okay, so now we're going to do olfactory, which would be the smell of something. So let me see if I can identify it. All right, so I identified it. It's the snowberry wreath that I usually get every Christmas. Now we're going to do optic, which is the Snelling chart. All right, so we're going to do Perla. I don't know how I'm going to do this on myself. So you're just going to follow the pen light. Oh, come on. There we go. Snellen chart is it stands for pupils are equal, round, and reactant. No. Pupils are equal, round, reactant to light, and accommodation. Okay, give me a second. All right. Oh gosh, sorry. Shoot. All right, so we just tested the ocular motor, which is the trochlear, the abducens, and let me see. Barely see now. I'm sorry, the Snelling chart. I can read something from far away, I guess. 6.99. All right, 6.99. I read that from far away. Now we were gonna do the Perla, which pupils are equal, round. Pupils are equal, round, reactant to light and accommodation, which we just did that with the pen light. Sorry, my eyes are still messing up. Now we're going to do trigeminal, so the light touch sensation to the face with a cotton ball. I do not have a cotton ball, so we're just going to use this little bead thing that I have. So I'm just going to tell you where it's going. All right. So now we're going to palpate the temple as the patient clenches the teeth. Clench teeth. Actually feels real good. And if you can see, there it goes. All right, so now we're going to do the facial test, which is taste of sweet and salty. What's that? Salty? Sweet. All right, so smile, frown, puff out cheeks, and raise your eyebrows. Close your eyes. Open. Perfect. Now we're going to do vestibulocochlear, that vestibulocochlear, vestibulocochlear, which is the whisper test, the hearing balance. So I would whisper 1, 2, 3, 1, 2, 3, ABC, ABC. All right. So now we're gonna do glossopharyngeal. Say ah, ah. Vagus, ability to swallow. So swallow. Spinal accessory. So we're gonna shrug our shoulders. Against resistance. All right. And turn head against resistance. You would hold them right here and they would turn, or they could turn like that. Hypoglossal, stick out tongue. Ah. No, not ah. Sorry, that's bad. And have the patient say light, tight, diamond, light, tight, diamondite, light, tight, diamondite, light, tight, diamondite. Ask for those 3 words to test the immediate, recent, and remote memory, which was bed blue sock, bed blue sock. All cranial nerves are intact. So now we're just going to test muscle strength of the upper and lower extremities. So now we're going to test that by doing the shoulder. We're going to do elbow. No. Flex and extend. Okay. So we're going to do shoulder. Elbow. Wrist. All right. Squeeze fingers. We're going to do hip. And we're going to do ankles. All right. And now we're going to do all muscles and are strong and equal bilaterally. And now we're going to test sensory function with eyes closed. Your sensory function is intact. Let's see. So, let's see. You're going to tell me if you feel this light touch with your eyes closed. Yes. Now tell me if I'm sticking something soft or sharp. This is sharp, this is soft. Sharp or soft? Sharp, soft, sharp, soft, sharp. Okay, perfect. So it looks like your sensory function is intact. So now, I don't have the turning fork. It's kind of like a backwards J. I would tap that on my foot. Let's see if I can show you. So I would tap it, right, if I had it. Ding, and I would put it on my big toe, and I would feel the vibration. So vibration is noted. All right. And I don't have the other one to where I can test the deep tissue tendons, but I'm going to use this. What it looks like is one is kind of like out like that, kind of like a triangle on one side and a little oval on the other side. So I would do the bicep, other arms, I would hold it up like this and I would hit the back and it would jolt. It's so much easier if I had somebody. And I'd do the front of the elbow, the brachial, right here. And then I would do the triceps, back of the elbow. I would do the kneecap, which, let me see if I can do it this way. Forgive me, guys. So you would go underneath, well, go right here, and it would move like that. And then you would get behind it. Well, you would go right below it and tap. And then you would get behind the heel, the achilles. You'd get right here, right up here, and you would make sure that they're sitting to where their feet are dangling from the bed. So when you do this, you actually get the reaction. So you would tap right there at that heel, and it would go down, we'll go up. And now we would do Babinski, which is trace a J, which is basic backwards J, kind of like a candy cane. That's how I remember it, on the back of the foot, and see if you get a reaction. So, okay. So now looks like all deep tendons are intact. I'm so sorry I didn't have somebody here with me. Please give me feedback on this one, because I do have some trouble trying to nail the ones at the back. So please get in contact with me with that. Thank you, and that is how you do a neurological assessment.